The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Has Canada taken the best course of action to curb the spread of the new COVID-19 variant? Should more or less be done? Tonight we'll examine the wider considerations that Omicron presents us. Then our Northern Ontario Hub's journalists will be here to reflect on this past year. And from restoring rural downtowns to the legacy of writer and Indigenous trailblazer Lee Maracle, we've got the agendas we can review. It's Friday, December 10th, and that's ahead on the agenda. It's probably fair to say that the new COVID-19 variant called Omicron is an entirely unwelcome arrival this holiday season. It's tangled borders, changed many people's plans for seeing long-missed friends and family, and it's highlighted some unsightly inequities on the global vaccine front. With us now on how to navigate this new variant, in Marshfield, Wisconsin, Maria Sundaram, epidemiologist and associate research scientist at the Marshfield Clinic Research Institute. And in Hamilton, Ontario, Dr. Zane Chagla, infectious disease physician at St. Joseph's Healthcare Hamilton and associate professor of medicine at McMaster University. Welcome back to you both.
Thank you.
Thanks for having us.
So I think a lot of us are just kind of, I don't know, frustration is the word, but a new variant is not something, we knew it could happen, but it's not something a lot of us anticipated, especially this time of the year. So Maria, I wanted to start with you. COVID-19 Omicron variant has been identified in Ontario, Alberta, and British Columbia. What do we know so far about how transmissible and how severe it is?
We have very limited information right now, but the information we do have suggests that it's incredibly transmissible. We know that it's outcompeting the Delta variant in South Africa, and we really expect that to be the case wherever it sort of takes hold next, and that includes Ontario as well.
And Dr. Chagla, this is not a new thing. We've had new variants before. What do we know about the Omicron variant?
Yeah, I mean, the evolution is very different other variants. We have seen 5 to 10 mutations for the variants of concerns we dealt with, but we're seeing 32 mutations here. And, some of those are concerning for immune escape more than anything else. And certainly the pattern we've been seeing in some countries is people being infected regardless of their vaccine status. And so, this creates a new susceptible population. As this starts spreading, it's not simple as saying vaccinated is going to prevent all infections. It really could bring, vaccinated people as transmitters back into the cycle, not necessarily the people that are getting the sickest, but could bring outbreaks and other things back to the forefront again.
Kids under 11 can now be vaccinated. And I think for people who are hearing what you're saying, there's another level of concern in the sense that, Omicron variant was identified in Southern Africa, but then we found out later that it was already spreading in Western Europe before South Africa identified it. And in response, different countries have enacted these travel restrictions. And Canada, to address Omicron variant, this is what our country has done. For travelers who have been in the following countries within 14 days prior to arrival in Canada, these are the countries: Botswana, Egypt, Eswatini, Lesotho, Malawi, Mozambique, Namibia, Nigeria, South Africa, Zimbabwe. The following applies. Foreign nationals are not permitted entry into Canada. Canadian citizens, permanent residents, people with status under the Indian Act are subject to enhanced pre-entry and arrival testing, screening, and quarantine measures. Travelers, both vaccinated and not vaccinated, arriving by air are required to stay at a designated quarantine facility while they await their arrival test result. Dr. Chagla, Canada has increased its travel restrictions to ban travelers from 10 African countries. Is this an effective way to combat the Omicron variant?
Look, if we knew exactly the moment this arrived, the region this arrived, maybe. But the reality of the situation is Southern Africa and South Africa particularly described this variant for the first time. They were not the source of this variant. And again, these travel bans really encompass the countries where it was first described. But we are learning more that Western Europe, the United Kingdom, has likely had community transmission for some time. So I don't think these travel bans blankly are actually hitting the target. Certainly enhanced enhanced testing after travel, a short quarantine period, measures at our border to treat all travelers universally as a risk are probably reasonable. But we are very likely to see Omicron cases come in through Western Europe, through the United Kingdom, through the United States. And what we're doing is creating an inequitable barrier to Southern Africa, Nigeria, and Egypt, while allowing these countries to have free access to Canada and infect our population. So, it's inequitable. It sends a terrible message to the world for the people that describe this variant, that they're facing economic hardships, their expats face hardships. There's political instability. But B, again, we're not actually doing what we should be doing in terms of reducing the risk of transmission in our setting if we ignore other countries.
Maria, Dr. Chegla brought up a really important point. He says this sends a terrible message to the countries that identified, in this situation, Southern Africa identified Omicron. Do you worry as a scientist that, some countries might be watching what's happening and think, what is the point of saying we have a new variant if the repercussions for this country is much greater than what other countries face?
Yeah, I mean, it's clearly a disincentive, which is really unfortunate, especially because it's very likely that Omicron was not originally existing in South Africa. It's just identified in Southern Africa, right? So when we institute these travel restrictions, we have to ask ourselves, what's the point? If the point is to slow the spread of Omicron, we have to be implementing this travel restriction across all of the countries that have Omicron. But we also see that there's community level transmission of Omicron in Canada right now. So, we really need to be asking ourselves, what's the best way to do this? And for me, the best way to do that is improved testing, improved availability of rapid antigen tests and other tests, and the availability of boosters as well.
Well, when we talk about the rules that we have around testing and the people who are coming into the country, earlier this week, the Auditor General, Karen Hogan, called out what she called the significant gaps in the Public Health Agency of Canada's administration of border control measures. Why are we seeing these gaps in terms of travel policies, Dr. Chegla?
Yeah, look, it's a human system, right? And the human resources to make these systems work are not necessarily there, to be able to police every traveler, make sure every test is followed up on every traveler. A lot of these are third-party contracts with companies doing the testing. There's a lot of holes in the Swiss cheese that can go wrong and lead to spread. And we've seen, obviously, the Alpha variant spread in Canada, the Delta variant spread in Canada. And so, again, these processes are faced with human error. We also know that hotel quarantines can be a source of infection. And we know, a case in Hong Kong where the Omicron variant went from someone from Southern Africa to someone that hadn't traveled to Southern Africa because their rooms were across from each other. So, all these processes have faults, and again, a rational process to test to make sure aggressive testing is done and using public health measures in those contexts probably pays more dividends than creating rules and guidelines that have loopholes that can be worked through and where human error can be introduced.
The Canadian-American border recently opened. And Maria, according to a survey conducted by Leisure and the Canadian Association for Canadian Studies, most Canadians are actually in favor of the stronger travel restrictions that we're seeing right now to combat Omicron. Being a dual citizen living in the United States, what are your thoughts?
I'm all for any sort of intervention that prevents the spread of Omicron in the U.S. or in Canada or across that Canada-U.S. border. I'm not convinced right now that a border closure is going to be the most effective way to do that. I think what we really need are a lot of, as Dr. Chagla said, a lot of different slices of Swiss cheese so that we can protect ourselves as much as possible. A border closure kind of gives us this false sense of security when in reality, I really think we should be focusing on testing, follow up very closely with people that are entering the country, and providing people the opportunities both to get tested, to wear high quality masks, and again, to be boosted if they haven't gotten a booster yet.
I want to go back to that survey. 65% of Canadians think the Canada-U.S. border should be closed for a period of time due to the Omicron variant. Maria, you mentioned testing and tracing and masks being the solutions to address what's happening right now. But if travel bans aren't the effective solution, what do you think Canada could do instead to prevent the spread of Omicron? Dr. Chagla.
Yeah, look, we're going to have to live with our borders being open at some point or another. And that point is going to be where variants emerge. And we are, in tune with our global partners in terms of the evolution of this virus. So, I think certainly enhanced testing is not unreasonable, a short period of quarantine until enhanced testing is complete. But we have to look at the long-term picture here. And, again, being susceptible to changes in the world on a moment's notice when a virus evolves means we have to provide the tools for the world to deal with this virus. And that really encompasses transfers of technology, transfers of medical services, and most importantly, vaccine equity.
Well, vaccine equity is something that we've been hearing a lot. And I think someone at the WHO, the UN, called it vaccine apartheid. Maria, 80% of eligible Ontarians have been fully vaccinated, while only 1 in 15 people in African nations have been fully vaccinated. How does vaccine inequality factor into the spread of Omicron?
I think it's pretty much the cause of Omicron as far as I'm concerned, right? So the longer we allow populations to be completely unprotected, the longer we put ourselves at risk of additional variants of concern like Omicron. So, we either can be planning for more equitable access of vaccines, or we need to plan what we're going to do when we're out of Greek letters.
Dr. Chagla, you've been talking about this a lot on Twitter, and I think people are very scared and worried about what's happening. And at the beginning of the pandemic, we kept hearing there was this debate, we should be listening to the people that we've elected and not the scientists. And now the science this time around, if you are living in a country where you can't even access a vaccine, and then we're in a country where we're being encouraged to get our third dose of the vaccine, what does the science say about this?
Yeah, look, I think we're learning that the neutralizing antibody levels, our first layer of response to Omicron, are reduced. And a third dose may support better neutralization and better outcomes. It's not perfect. And so certainly people that are eligible for a booster, those who have medical conditions, who are over a certain age, who are at high risk of infecting people in those two groups, they should probably be getting their booster. But I think, again, the evolution of this virus is not going to be kept in check if we keep revaccinating our own populations. We really do need to think about what strategic groups we boost and what strategic groups and what strategic outcomes we want from a global vaccine standpoint. And that involves transfer of vaccines through donations, but also tech transfers and supporting local innovation in vaccine development.
In this province, while we have a good chunk of people who have been vaccinated, we still have a lot of people who haven't been vaccinated. And Dr. Chagla, you've been vocal about how developed countries, including Canada, have been contributing to vaccine inequality. How have we been doing that?
Yeah, we've taken a lot, right? Like we have stockpiles of vaccines. When we started our booster campaign, there were 14 million dosers in freezes. And those were given out as boosters, but at the same time, we shouldn't have 14 million doses in our freezers, especially as we don't produce any doses in Canada. And so those doses are ones that COVAX could fulfill, that countries with contracts with Pfizer and Moderna could fulfill. But instead, they're sitting in a freezer in our country. And so we're just as liable for what's going on in this world. We're making major changes to deal with Omicron. And we have to be very rational of how we bring vaccines into this country. It can't be an open door because, again, it's a vaccine on our soil that can't be used on someone else's soil.
Maria, Canada and the U.S. have both been donating vaccines to countries in need, even though we have vaccines in freezers. But why haven't these donation initiatives been more effective?
I think there's a couple of different gaps here. One of them is the difference between the number of vaccines that have been pledged to be donated and the number of vaccines that have actually been donated. There is a pretty substantial gap in between those, and a promise really doesn't cost very much. The actual donation is what is actually impactful. So we really need to look at that, the difference between what we're saying we're going to do and what we're actually going to do. But the other sort of gap in my mind is how COVAX was supposed to work and how it has functionally worked. So it was supposed to have worked by these high-income countries buying in and supporting this purchasing power of low and middle-income countries. In reality, though, we had this global vaccine shortage, and what wound up happening was that these high-income countries, the U.S. and Canada included, decided, actually, I'm going to put myself at the front of the line. And Canada was a good example of that. Canada actually drew vaccines out of COVAX in the first round, which is really not how COVAX was designed to work. And so, we've set out these goals for ourselves, which are very nice, but we have kind of lost the plot on the way to accomplishing those goals.
Dr. Shackle, how do we come around to the thinking that we've talked about the virus, the longer it's around, it's going to mutate. But if one country isn't fine, none of us are fine. How do we change how we approach that?
Yeah, I mean, I think Omicron is the global lesson, and we're doing a terrible job at it so far. We've invoked travel bans and escalated booster doses in countries that are not facing mortal risks from Omicron yet, and leaving the rest of the world at its baseline. So, I think we have to strengthen the World Health Organization in order to deal with this. There's work towards a global pandemic treaty so that we have integrated access to this pandemic, tools to this pandemic that are not limited to resource-rich settings. And I think for all of us, as we are getting our boosters and they're provided to us, we have to think about where the next goes. And making sure that we advocate to our provincial and federal leaders that this is not a pandemic of Canada alone. This is a pandemic of our world.
I want to come back to that, what you just said, but I wanted to bring up another quote from that survey that I mentioned earlier. 78% of Canadians support their government accelerating plans to introduce a booster third dose of the COVID-19 vaccine for certain populations. Dr. Chagla, you just said, when you are getting that booster, you should be thinking about, someone around the world. We're encouraging Canadians to get vaccinated and to get booster shots to get protected. How do we make sense of that from an ethical point of view?
It's tough, right? I mean, the science does support getting a third shot for certain populations. I don't think anyone denies that. There are breakthrough infections. We restore neutralizing antibodies with the third shot. I think we have to think about this more from a resource scarcity standpoint. So what if we were the country last in line? What if we were looking at people getting their booster doses before we had access to our first? What if we were healthcare workers working in an Omicron surge with only 25% of the healthcare work population vaccinated that has been described by the African WHO. And so, I think those pieces need to be there as part of our messaging around booster doses. We are privileged. We have doses. We have to use them, and so be it. But we have to think about the next dose and our long-term vaccine plan not being fully Canadian, but global.
Maria, I want to ask you that same question.
I think it's really tempting to think that if I don't get a booster, that shot could go to someone in a lower middle income country, and that's unfortunately logistically not the case. The vaccines that we're using in Canada right now are not driven by demand; they're driven by supply. So, if you're eligible for a booster, you should get boosted, and you should not feel as though you're taking away a dose from someone else. But at the same time, just as Dr. Chagla said, we have to be advocating to our local and federal politicians and our policymakers to say, you know what, I don't want another vaccine because of another variant of concern that's occurred because of global vaccine inequity. And I agree that there's absolutely no circumstance where it's ethical for me to have 3 vaccine doses and a healthcare worker in a high transmission community have none.
Many public health units have advised for smaller gatherings this holiday season. I think a lot of us have been waiting to celebrate this season because last year we didn't get those opportunities. What should we keep in mind moving forward within the next few weeks? I know a lot of people are exhausted from having to make decisions and having to change plans. But as we head into this holiday season, what should people keep in mind, Dr. Chagla?
Yeah, number one, this is a point in the year where people are kind, people are reaching out, everyone is working towards, families being safe and that type of thing and enjoying the holidays. And so it is a time to bring up those first dose conversations amongst people that have not had them. And again, coming from a place of respect, but knowing that family and trusted peers can often reach people better than myself or other people in the medical profession. But number two, I think all of us need to take tabs of making sure that we get tested when we're symptomatic, that we keep the gatherings relatively small and know the consequences, and that the people that are eligible for a booster, particularly are old, vulnerable, those with medical conditions, get it. And knowing that this Christmas holiday or this next coming couple of months, we're going to see a lot of disease transmission in our community, we need to make sure that this is an opportunity that our family and friends are safe as well.
And Maria?
I think, I really agree. I couldn't agree more with the feeling that everyone is exhausted. And I really understand that, we're really done with COVID, and unfortunately, COVID's not done with us yet. So the good thing is that we're not starting from ground zero. We really have a lot of things that we've learned over the last couple of years in order to keep ourselves safe and to keep our families safe and our loved ones safe. Those include vaccination. They include high quality masks. They include physical distancing, if possible. And that may not always be possible, or it may not be just a viable option during this time of winter holidays. And then we have to think about what other slices of Swiss cheese can we add to make this building or this family as safe as possible. Testing is another really important part of that. So we really do have the tools. We do have the understanding at this point of what we can do, and we just need to follow through.
Dr. Chagla, since you're here, I can't let you go. We only have about a minute, but McMaster University will soon begin human trials for the inhaled COVID-19 vaccines. You're an associate professor there. Can you tell us a little bit about what's happening there?
Yeah, absolutely. So they're using a platform similar to AstraZeneca and Johnson & Johnson, but using it as an inhaled form. There is a mechanism here to use a conserved protein of COVID-19, so something that might not be as, dealing with the variants change around that much, and using inhalation, which is actually really cool because not only does it help needle phobic people? But using things like dry powder as the inhalational form may make international distribution a whole lot easier as well.
I think my kids will be very happy when that's available for children because they're getting their vaccine this weekend and they're very nervous about the needle. A big thank you to you both. I know you're both very busy. Thank you for helping us to make sense of what's happening right now. We appreciate your time.
It's my pleasure.
Thanks, Barry.
While rising COVID-19 case counts are currently the big news out of Northern Ontario, it's just the latest in a year that saw a lot of important stories from that part of the province. With us for a look back, Charnel Anderson, who covers the Northwest for Ontario Hubs. She joins us from Thunder Bay. And Nick Dunn, who covers the Northeast for the Hubs and joins us from Sudbury. Welcome to both of you.
Thank you.
Thanks.
So Nick, let's start with you. Can you give us the latest on the outbreaks in Northeastern Ontario?
Right. So the Northeast has really been the epicenter of the fourth wave as far as cases and case rates go. Most notably, Algoma has consistently led the top case rate in the province per 100,000 people. The health unit hasn't been too specific as far as necessarily where this came from. There's been a lot of community spread. And it persists in various outbreaks in all sorts of different settings, but no particular area has been identified. In Sudbury, throughout November, we saw quite a bit of spread in schools, about 15 outbreaks that were school or school-related, including bus lines. So it was really spreading there, but since then, in early December, we're seeing Manitoulin Island really pick up. Wemekong, the largest First Nation on the island, has seen a major elevation increases, and as far as Temiskaming, it has also been very, very high as far as its case rate, but it peaked at around 80 cases on November 26. It's a very small health unit, so when there's a small increase in cases, it can really spike the overall case rate. That said, it's still a very small region, not a lot of hospital capacity. So it's been very much a concern for the health unit there as well.
I want to move west to Thunder Bay, where I understand the new variant, Omicron, has been detected there. Charnel, what do we need to know about that situation?
That's right. So earlier this week, the Thunder Bay District Health Unit issued a press release confirming that the Omicron variant has been found here in Thunder Bay. The health unit says that those cases are directly linked to travel. There's a direct link to South Africa, where, of course, the variant was first identified. And in that media release from the health unit, they suggest that these cases are contained to one household, saying that there is no evidence of spread outside the households. But even before the Omicron variant was discovered, we've been watching COVID cases rise in Thunder Bay. Over the last few weeks, there's been a number of outbreaks at both elementary and high schools. One school even closed for a week after almost 27 cases were connected to an outbreak there. So Dr. Janet Mill, the medical officer of the health of the Thunder Bay District Health Unit, is asking parents and guardians to screen their kids for COVID symptoms, reduce the number of contacts as much as possible, as well as keep their kids home if they're sick, in addition to, of course, getting vaccinated.
That's something I'm sure both of you will continue to follow as well. I want to touch on some other stories. I know we've been talking, you guys have both been on the show talking about the pandemic throughout the last, 2 years, but you guys have both talked about some other tough stories. I want to start with Nick. Are there stories that have stuck with you that you have sort of told throughout the several months?
Yeah, it's a tough one, Jayan. Obviously, the situation at Laurentian U with its creditor protection situation has been really a big one to watch up here. It's a really significant economic driver to the region. It's a place of higher learning for the entire region, not just in Sudbury. So that's been playing out in numerous ways. Most recently, the Auditor General is in court right now with Laurentian, trying to access certain documents. She said it's one of the least transparent institutions that she's ever worked with. But I think for me, the biggest story, and this goes nationally, has been the Kamloops discoveries of unmarked graves. This has really rippled across the entire country at a national level, but also at a hyper-local level. I mean, individual First Nations searching or contracting people out. It's really brought up a lot of difficult memories, and it's also been one of those stories that's been hiding in plain sight for the average Canadian, and a real wake-up call to what had happened and how this kind of plays out today in our current political landscape, social issues, and whatnot.
Charnel, I'll turn to you. Let's talk about your region. Is there any stories that stick with you throughout your reporting?
Yeah, so one story that really stuck with me is a piece that I did about hospital visitation policies during the pandemic. In order to slow the spread of the virus, hospitals began restricting visitation. And this decision had many consequences for, of course, patients, their families, and healthcare workers. And this decision also led to calls for more responsive evidence-based visitation policies, because in some cases there were really tight restrictions in place when maybe there weren't enough COVID cases in the area to kind of justify those restrictions. And this meant that people couldn't be there for their families during some of the most precious times of their lives, right? Whether that's giving birth or comforting someone who's in the process of dying. And I think this stuck out with me because, unfortunately, my family, we lost my grandpa last month. And, he had been in and out of the hospital for a period of months. And there was one time last spring, my grandma went to visit him in the hospital, in Thunder Bay, and she was told that she wouldn't be able to do that. And this was really frustrating, of course, because my grandpa was really agitated in the hospital in this unfamiliar environment. And I think, a familiar face might have been able to calm him down to really everyone's benefit. So there was a bit of a scene at the hospital. I heard that my grandma tried to kind of make a run for it past security to go see my grandpa. So she got sent home. But ultimately, they were able to sort something out, and she was able to go visit him. But there was a lot of anguish in the meantime, right? And so, that was just kind of a story that is really about, these stolen moments that the pandemic has wrought.
And both very important stories from Nick and Charnel. I'm curious, looking into the next year, a lot of these stories will continue, but are there some stories that you guys are looking at and sort of have started to dig a little bit that we can look forward to? I'll start with Nick.
Right. So one big thing for me has been the Ring of Fire. I mean, it's really stuck in the environmental assessment process, both provincially and regionally from the federal Environmental Assessment Agency. So it'll be interesting to see how it plays out or doesn't play out, just given how long the delays have been across the board here, and just the level of opposition. Another big one is the Robinson Huron annuity case, which I've written about. It's entering its third stage of negotiations, where basically the Crown and the 26 First Nations in the Robinson Huron Treaty are going to be negotiating around compensation, around a future annuity. This has been an issue that's been lingering for about 150 years now, and I think lawyers, First Nations, legal experts are really looking to the precedent that this case could set as far as revenue sharing goes when it comes to resources and ongoing treaty discussions and disputes.
And Charnel, let's talk about sort of what you're looking at for the new year in terms of stories.
Yeah, well, so it's full on winter here in Thunder Bay. It's been really cold this week, which means, a lot of people are inside if they can be. And so, I'm just going to keep an eye on the COVID numbers and kind of see how that's going to be impacted this winter. But also, for the people that have nowhere to go this time of year, I want to look at the different supports that are available or not. We're waiting to hear the province's response to a proposal for a 40-bed mental health and addiction crisis center here in Thunder Bay. So I'll be following that for sure.
Some very important stories, and I want to say we really appreciate your reporting from the northern communities that you guys report from. And this is probably the last time that I'll be seeing you before the holidays. So happy holidays, and wish you guys all the best.
Happy holidays.
You too. Take care.
The agenda this week debated how best to approach restoring rural downtowns, consider the complexity of free speech today, and learned why inflation is an ongoing concern. The agenda's week in review begins recalling the legacy of groundbreaking Indigenous writer and scholar Lee Maracle.
Well, I'm one of those privileged few and many that actually knew her on a very personal level. I knew her as a friend. I actually knew her as a friend before I was well versed in her writing style. I also knew her as an actress. Not many people know she appeared in several of my plays. She was a wonderful, versatile, talented, opinionated, strong woman. I'm running out of adjectives here, but there are more adjectives to describe who she was. And they say, and I it's such a cliche, but I do honestly 100% believe the world is a much less interesting place and much more boring place now without her.
Tanya, happy to hear some more adjectives from you.
Well, I think the most important one is that Lee was my friend. And it was unbelievably upsetting to hear of her passing, knowing what she's done for so many of us, so many Indigenous writers, so many women, Indigenous women, authors. She, as Katrina said, she stormed the stage. She blew open the doors for us. And as Daniel said as well, it was before the reckoning, before people really understood. She was a force of nature. She could just, the power of her words. I mean, if you've ever seen her speak, if you've ever seen her take on a question from somebody at the end of a speech, when someone asks something mildly racist, because we get that all the time as an Indigenous author, and you're standing, on a stage and someone asks something or says something, and she could bring someone down like nobody's business, but do it in a really thoughtful, smart, strong-handed way. And nobody ever said no to Auntie. That's so true. I mean, if Lee Maracle called you and told you to get over to her house or to come pick her up, you did it. And you did it happily because and you knew that wherever she was going, whatever she was doing was really important, and you also needed to be there with her.
Wabgishik, what would you add to that?
Well, I would add that she was unrelenting in many ways. She was unwavering in her passion for her people and her stories, and also for the rest of the storytellers that she made space for. She was a massive presence in any room that she inhabited. But on the other hand, she was also very caring, very considerate, and she would always ensure that those of us who came up after her felt empowered and felt comfortable in these often hostile and foreign places. And everyone has said she's been like an auntie. She is very much a literary matriarch. And coming from a res, I have been dependent and reliant upon aunties, grandmother figures, and so on. And to come off the res and into the city and into these literary spaces, and to have someone like her there for me, I wouldn't have accomplished what I have without her presence and without her just kind and compassionate spirit that has really held me up since the beginning.
Well, the New York Times, not every day to be sure, does an obituary on somebody from this country who dies, and yet the New York Times did an obit on Lee Maracle, and it described her, interestingly enough, as combative. Although, and I'm hearing some of that in the responses that you three just gave, but if you look at pictures of her, and we'll put some up right now, she's almost always got a smile or a laugh on her face. Drew, what's that about?
Well, I have to say, one of the most defining features of Lee Maracle was her laugh.
Yes.
You could find her in the middle of a 100-kilometer wide hurricane just by her laugh. She was quick to laugh. She was eager to laugh. She loved the world. She loved humor. She loved everything that was amusing, which did not take away from the fact that she also was very much aware and very critical and very responsive to all the negative things in the world too. But when I think of Lee, I think of that laugh, which would cut through cinder blocks, and just it's almost like a calling to her.
Tanya, I think we need to understand that better, because how can somebody who had so many doors slammed in her face and had so much adversity to have to deal with be so apparently happy and laughing at the joy of the world at the same time?
It was her strength of spirit. She really was strong in who she was as a woman, who she was as a Stolo woman, where she was from. She was grounded in place, grounded in the land, and she was grounded in her language, all of her relations. And she had a wide net of family and friends and everybody who loved her and held her close and whom she held up. As Wab was saying, she always made you feel welcome. She always included you, and she never cut anybody down.
I want to just start sort of at the 30,000-foot level, and then we'll drill down deeper and see what you think. But as a general statement, what do you think of what these folks are trying?
Well, I think I'd start off by saying, I'm always happy to see people interested, curious, passionate about rural, small town life. However, on the flip side, I simply don't believe in benevolent capitalists. It just doesn't exist. So I think that we need to be both happy that people are interested in rural and small towns and in seeing what the potential of these places are. But we also need to be very much aware of the wealth structures and power dynamics that are at play here, in terms of when we buy up property at a very high price point, that also drives up the property values of everywhere else around it and ends up displacing people who may not have immense means of their own. It also results in some other complicated factors around. I love seeing people want to invest in these structures. However, how much resistance will come when your municipality says that means that your tax rate needs to go up in order to invest in the commensurate infrastructure? So we always have to be aware of what the good and the bad is. So one of the things that's interesting about focusing on tourism in particular is that a lot of these places are kind of replicating almost like a faux European visual to them that is quite literally colonialist, right? Like, this is quite literally about replicating a European look and feel in another place instead of place-based, which is about how do we combat structural urbanism, right? This urban default. So who are those storefronts marketed to? Who is the clientele for that? Is it local people? And then finally, it's one thing to have somewhere to stay for a night. It's another to have a place where you can build a lifetime and a life. And so when we focus on tourism as the only mechanism for rural and small town economic development, we're really focusing on largely cyclical, low paying, low benefit, low security jobs, rather than looking at, okay, if we're building these initiatives, are we paying a living wage? Are we ensuring that there are benefits attached to these jobs? Are we making sure that the people that are working in the bookstore or in the hotel can afford an apartment or a home in their community? So it's all of those things at once that we need to kind of take a look at. And I'm always cautious about a lot of outside wealth coming into rural and small town communities and deciding what it should look like and feel like, rather than saying, how do we invest the things that are going well already and build up the assets that are already in place, using local skills, local infrastructure, and making sure that we're keeping this eye on a complex, diverse future, rather than just one vision of what success should look like, which is largely urban-based.
Okay, Ashley, I'm going to stop you there because you put a number of criticisms on the record, which I want to give our other guests a chance to speak to. Let's start with Greg. Do you want to speak to the issue of gentrification and whether or not, by bringing your property back to life, it increases the value of so many other things in the neighborhood, which, as we know, has both positive and negative consequences?
Well, yeah, Steve, I couldn't disagree with Ashley more. The fact is that the revitalization of small town Ontario is a phenomenon that's happening. People are leaving big cities and wanting to relocate in small towns, and that's a healthy thing. My goodness, the maritime provinces are developing, are having a population growth that they haven't seen in decades. In our own case, we're just we're not bringing Prince Edward County back to life. Prince Edward County is a very vital community. There's a very strong agricultural base. We own a farm here. The Royal Hotel will buy produce from a number of farms here. There are a number of wineries here. They sell their product all over the province. Prince Edward County is growing, and it's growing rapidly. And what we're doing at the Royal is just one small part of it. It's not colonialist. It's not European. It reflects what the Royal used to be. It's giving it's giving this county back something that it has wanted to have for a very long time. So, I'm sorry to go on, but as far as the working population is concerned, we are going to be paying high wages because that's what you need to attract good people. We also bought a couple of houses very close to the Royal to provide low-cost accommodation for the staff that will be working for us. So, I mean, Ashley, it all sounds very interesting and critical, but I just disagree with you.
Emmett, where are we in 2021 regarding, quote, the freedom to express oneself openly and fully?
Well, I think we're facing a lot of challenges. We have a discomforting percentage of the population that is susceptible to misinformation, disinformation, conspiracy theories. This is making it challenging to confront the real threats we're facing today, like the pandemic and climate change. We're facing a lot of hate and hate speech, particularly online and on social media. And we're in the midst of a climate where free speech as a liberal democratic value is actually itself subject to ideological polarization and contestation. And so I think, I don't know that I would label the problem of one of being a free speech crisis, but I would say we are facing enormous challenges about when speech is harmful, how to address that harm while living up to the ideals and values a democracy should hold dear.
Let me do a quick follow-up with you, because the quote you use in the book is, free expression is seemingly under threat. So I want to know if it's actually under threat or sort of under threat.
Well, I think it's under threat to the extent that there are now discourse and attitudes around free expression that we should be worried about. There's evidence that younger generations are much more open to censorship and restrictions on speech, more so than they used to be in a number of areas. We see controversies on university campuses around things like deplatforming and censorship that should give us some pause. At the same time, you know, if we compare Canada to most other countries, we would still say we have quite a strong, flourishing, and receptive culture around free expression. So it's not all doom and gloom, but there are reasons to worry. There are reasons to remain vigilant about free expression.
Well, let's go back 40 years. And Carissima, I'll ask you to pick up the story. We got a Charter of Rights and Freedoms in this country 40 years ago. How well do you think that charter protects our free speech and free expression rights?
I think it protects freedom of expression fairly broadly in terms of the general interpretation of Section 2B of the Charter, in that very early on, the Supreme Court adopted an approach under which any attempt to convey meaning short of actual violence is protected by the Charter. But, and this separates us from Americans, for example, all of the rights in the Charter are subject to reasonable limits under the first clause of the Charter, Section 1. And that's why, for example, we have laws criminalizing hate speech, and we have some human rights codes that include the ability to make complaints against certain kinds of expression. And what the court has said is that while we value freedom of expression very highly, there are certain conditions under which the state, and it does need to be the state, can limit that expression, because there are other social goals that are very important. So I do think that we have powerful protections under the Charter. They are always subject to debate and delineation. There was recently a Supreme Court of Canada decision that ruled in favor of freedom of expression, but quite narrowly, and that's got a few constitutional scholars on edge, and maybe we can talk about that case that arose in Quebec. So powerful protections, but subject to, I think, some debate.
And a quick follow-up here. Do you find it interesting that our free expression rights are Section 2 of the Charter? Not Section 1, Section 2. What do you infer from that?
What I infer from that is that the framers of the charter wanted to make it clear that all of the rights and freedoms were not absolute, and that's why the first clause is the reasonable limits clause. But what I will say is that the fundamental freedoms, which are protected by Section 2, are the first ones that are mentioned. There's no legal relevance to that point, but it's true that if you read the charter and you start reading it, the very first section is one that makes it clear that the rights are subject to some limits.
When the Bank of Canada says inflation is running at 4%, what goes into getting to that number?
Well, first of all, we've all heard of the CPI, so that's a basket of goods. So basically what it's saying is, how does a basket of goods, if you were to walk into a shopping center and buy the same basket of goods this month as you did last month, how much more did you pay this month versus last month or last year? So it's really trying to put a common measurement around what is the average Canadian household feeling in terms of prices going up over time. So it really is an average. Now, the Bank of Canada will have, many different variations of that metric to calibrate its policy, but at the very basic level, that concept is how much more is an average Canadian household paying than they did relative to last month or last year.
Benjamin, let me follow up with you in this regard. For policymakers and for politicians, for deciders, to be able to make the best decisions as it relates to dealing with inflation, whatever economists put into that basket is pretty key, right? Because if you're not measuring the right things, then that number really doesn't mean much. What's in that basket, and how do we know that it truly, truly accurately reflects the state of play for the average Canadian day to day?
Yes, that's a very good question, because during COVID, we know that the basket changed because we weren't consuming services. We consumed a lot of goods because you press a button and you get your exercise bike. So the distribution was very different. And Stats Canada basically changed the way they calculated it to reflect that. So that's why we saw a little bit of volatility in the numbers. But you're absolutely right that it's a reflection of what's happening at a point in time. Now, there are some prices that can go up and down very quickly, like food prices, like energy prices. And that's why the Bank of Canada likes to focus on something called core inflation and other measures that really exclude all kinds of volatile segments of inflation. So you really want to focus from a policy perspective on what's stable, what's really a real increase in inflation, as opposed to just a one-day jump in food prices. And that's a challenge that they're facing now.
In which case, Rebecca, obviously food would be in that basket, but gasoline would be in the basket, gasoline for your car. But what else? For example, I know 20,000 people who went to a football game in Toronto yesterday. Would the cost of a football game ticket be in the basket? Would the cost of buying art at an art gallery be in the basket? How do you know what's in and what's out?
Absolutely. So if you're really interested, you can go on StatsCan's site and see down to the second decimal point what percentage these activities will be in the basket. So obviously recreation is a smaller share of the basket. So for the average Canadian household, about 50% of those expenditures are around shelter and food and energy costs. So, and clothing as well. So what you might consider the essentials. But that really is an average. And so one of the reasons why Canadians feel inflation differently is that we're not the average Canadian, is that we have different shopping habits, and we also have different levels of disposable income. And so not every Canadian is out there buying football tickets, so they may be feeling inflation different than that average metric that StatsCan is providing.
I noticed there was a lot of inflation.
If I may, actually.
Sorry, go ahead, Benjamin.
One thing about shelter, because people say, house prices went up by 20%. How come it's not in the CPI? Because that's not the way they measure it. They measure basically consumption of housing services as opposed to the house of price, the price of the house. And that's something that we have to take into account. So people are looking for the CPI to reflect the huge increase in house prices. You will not find it there. It's much more sophisticated than that.
Okay, well, follow up with this though, Benjamin, because if inflation typically runs at 2%, that's usually the target they like to go for, and then suddenly it ends up at 4%, You know, some people might look at that and say, well, that's only 2 points higher. So does that really affect my bottom line all that much? What's the answer to that?
Yeah, that's a very good question. So first of all, let me just say one thing. Nobody knows where inflation will be 6 or 8 months from now. And when I say nobody, I include the Fed in the US and the Bank of Canada. We're all pretending, but nobody really knows because we haven't seen in this kind of situation. So back to your question, the target is 2%. The Bank of Canada is very clear about the fact that they are willing to tolerate higher inflation, higher than 2% in 2021 and even 2022, as long as they can bring it back to 2% in 2023. Why is it so important? It's their credibility. It's not about the number. It's because what it shows. We have been fighting inflation for 50 years with a lot of success, namely banks, central banks established their credibility and their ability to fight inflation. And therefore, at the end of the day, it's not about inflation. It's about what will take to bring inflation back to 2%, because I think it will be back.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, December 10th, 2021. Recently, Ontario's Auditor General hammered the province for its handling of COVID-19 relief spending. We'll find out more on Monday. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a great weekend, and Steve will see you again on Monday.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman.